Welcome to another edition of Arthritis Wellness Conversations. As always, I am joined by a research scientist from Arthritis Research Canada and members of the Arthritis Patient Advisory Board. Joining me today is Dr. Susan Bartlett, along with from the Patient Advisory Board, we have Samantha, Eileen, Shannon, Nikki, and Chris. Today's topic is one that is something that's pretty familiar for those of us that are living with arthritis, and that is the topic of fatigue. I thought we would start in with just a quick check-in with you, Dr. Bartlett. What causes fatigue in someone that has arthritis?
Well, I think that there are many things that cause fatigue. That's what makes it part of a challenge. It's universal. It's ubiquitous. We saw here, everybody was endorsing fatigue. More than 80% of people with inflammatory arthritis in particular report up to severe levels of fatigue. So it's part and parcel of having arthritis. And it is, in fact, caused in part by the arthritis, so the pain and the disability. Certainly if you have inflammatory arthritis, as the inflammation goes up, so too does the fatigue. Also, just the changes that occur in the body as a result of arthritis. The loss of muscle mass, for instance, all contribute to fatigue. But there are other reasons too. So people with arthritis often have other illnesses. Anemia, hypothyroidism are a couple. Cardiovascular disease is much more common. And the medications that we use to treat these diseases. Many of those medications cause fatigue. Methotrexate, for example, is just notorious for causing fatigue. There are a few medications that do actually help. And with inflammatory arthritis, as your inflammation comes under control, fatigue generally goes down. But anxiety and depression, fatigue is a hallmark of both of those conditions. And then we have everyday life. So there's the social demands that we all live with, the work demands and how you manage them. And many of us are people who are not prone to necessarily balance. So it's something that we really have to learn, how to balance activity with rest. And then there's, what we do every day in terms of our health. Dehydration, really, really important. Nothing will make you feel worse than being dehydrated. So every time you feel fatigued, make sure that you're having a glass of water first and foremost. But poor nutrition, poor sleep, lots of stress, physical inactivity, sitting too long each day, excess weight, all of those things will in and of themselves contribute to fatigue. So you put it all together, and it can become a bit of an art form to try and tease out what in particular may be contributing to an individual's high levels of fatigue.
Yeah, for sure. I mean, there's so many factors, just like you were mentioning. I was asking the members of the Patient Advisory Board if the fatigue fluctuates or if it's a constant. And Shannon, you in particular have fatigue pretty much all of the time.
Yeah, it's just the degree of the intensity. Yeah.
Other feedback from others that it would vary depending on different factors, like Susan was mentioning, different activities, different levels of inflammation. Can anyone speak to the fact of the fatigue that they feel from medications?
Yeah, I think I can speak to that. I generally, if I'm on the right medication, I actually don't experience much fatigue. But like you mentioned, methotrexate and other medications I've been on before, I've all of a sudden experienced high levels of fatigue. So I think that if it's treating your whole disease, hopefully you're able to, with medication, diet, exercise, all those things that Dr. Bartlett mentioned, some people are able to manage it quite well. And I think it's also making sure that you stand up for that as an issue. So when I experienced that on a medication, I realized it was not the right medication for me. I couldn't live a productive and really healthy, balanced lifestyle experiencing that level of fatigue. So it was important for me to bring that up and say, sure, maybe I'm not experiencing pain from my arthritis right now, but unfortunately the side effects are just as debilitating. So really advocating for, those symptoms or side effects being potentially just as damaging to your lifestyle, and ensuring that you work with your team to get it in check. That's been hugely helpful. And I'm lucky enough that with all of those things in check right now, I don't experience fatigue pretty much at all, but it was very medication driven.
Mm.
And that's why it's important to be in tune and to listen to and respond to what our body's doing, because that was an indicator for you that perhaps the medication that you were on wasn't the right fit for you. I wanted to move on now to the impacts of fatigue on our daily life and some of the things. Nikki, I thought I'd pop in on you. You had mentioned about it impacting your work schedule and your ability to perform there.
Yeah. So pre-COVID, when I was working at my workplace, it was more customer based. And so I'd be meeting customers throughout my day. And there'd be times that if I had a 9 a.m. booked and I could not get up to get there at 9 a.m., I'd be texting my manager saying, hey, I'm having a really bad fatigue or flare day. And so she'd try and arrange my appointment to either come in later or try and see if another advisor was available at that time. But yes, there's been a few times where I'd get into work and I just feel like such a zombie up until the afternoon, even all day actually. So it had been really challenging. Working from home does help. I kind of work at my own pace.
Eileen, you had talked about the mental health aspect of fatigue and sort of the combination of your also being a parent. Did you want to share a little bit about that?
Yeah, so fatigue and the energy of a toddler or a young child definitely don't mix. So as a single mother and with a young child, it can be really challenging because I might be having an okay pain day, but I'm just so tired to tackle on everything that I need to as a parent, or as just anybody with daily activities. And that can drive a lot of guilt. And that guilt really kind of builds up inside, and it can trigger a lot of anxiety and depression. And so it goes in this circle where you're fatigued over something and then you can't do what you need to do. So then you're upset with yourself and then you're more fatigued and you're laying down more. So now you have more pain, and it just can trigger about every symptom possible.
Mm-hmm. I know I recall when I was during high levels of inflammation and really debilitating fatigue, it would be so frustrating to have to rest after getting up, after brushing your teeth, right? And it's like, so when it's intense, that's how much it can impact. And it's different than being tired. Does anyone have anything to sort of relay an example that on that? Yes.
I don't have an exact. Sorry, Eileen. I was just going to say, because yours is probably better. I just wanted to say that there's no way that you can relay what this fatigue feels like to a healthy person who knows what tired is. It's completely different.
I like describing it as if, say you wake up in the morning, you have a shower, and you're super refreshed and you're ready to take on your day. Well, lots of times people with chronic fatigue will have to actually have quite the rest after even just taking a shower, and that maybe is one of the only things that they can actually tackle in a day.
Well said. Yeah.
I think that also, like I've described it as feeling out of focus. It's like not having glasses on somewhat. You're not able to actually pay attention to that task in front of you, or, you're awake, but you're not fully present.
And there's not enough coffee in the world.
I believe cognitive dysfunction is one of the least talked about symptoms with rheumatoid arthritis, and I find my fatigue is probably the biggest trigger with that. Sometimes I'm thinking I'm reading something, I'm so foggy that I'm actually reading something completely different, or I'll just randomly forget words in the middle of a sentence. I've learned to just kind of brush it off and laugh at myself now, though.
I would agree. It does feel different than being tired. For me, I know that anemia is part of the reason behind my fatigue, and it feels like especially for me, it affects exercise more than anything, and it feels like my legs and my arms are full of lead, like I'm just heavy and just weak. It's more of a weakness. Once I get going, once I get over that hump and get moving, I feel a lot better. But still, it's even after the exercise, I'm drained quite quickly afterwards.
I have to agree with you there. I found out I was anemic, vitamin D deficient, and also living with a copper deficiency and like the heavy legs and like not being able to do anything. I just felt like I had a weight on me, and my fatigue has never been that high. So yeah, it's really important to get your deficiencies checked out because it could be a definite culprit to your fatigue.
That's like myself, speaking with Chris in terms of exercise. I worked out really intensely for the past 2 days that this morning I woke up and I had my gym schedule booked in and I had to cancel last minute because I could just not physically get out of bed. And then once I did, I just like, even now I still feel very fatigued, and I just had a cup of coffee and that's not doing anything.
Dr. Bartlett, is there actually a clinical difference between fatigue and tired that you can pinpoint?
So it's interesting that you ask that. I've been part of groups, OMERACT is one of them, and then some work with colleagues in the United States and with the FDA recently, where we've been looking at fatigue. And people around the world say exactly what I'm hearing here, that it's a very different kind of feeling. It's so different than just being tired. It's not relieved when you get sleep. It affects all areas of your body. It feels often like you feel just before you come down with a bad flu. There's a heaviness, there's a weight that goes with it, there's a brain fog that's associated with it. You know, interestingly enough, although patients have been talking about fatigue with arthritis for decades, it's only been recently that clinicians and researchers and drug developers have started paying close attention. And there is some good news in all of this because patients have been willing to speak up about their fatigue. And in fact, most patients will say, you know, I can deal with the pain. It's the fatigue. Can you not do something about this fatigue? And people are listening. The right people are listening. And so I've been part of a group that's been working with the FDA for the last couple of years, trying to look at exactly the best ways to measure fatigue so that fatigue measurement will be part of the development of new RA drugs. We've seen it recently. There's been one drug that has come out that has an indication for fatigue that talks about if you're feeling fatigued, this drug may actually help. And a lot of work is going in right now to try and understand which drugs may be more effective, because we're beginning to understand some of the pathways. But because there are so many reasons that people experience fatigue, it's very unlikely there's going to be one medicine or one class of medicines that rise to the top and always work. So it will always be a matter, I think, of making sure that if you have inflammatory arthritis, for instance, that the disease is as well controlled as it can be. And then if you're still experiencing fatigue, to look at what that's telling us. Is it telling us that your disease actually is just smoldering away? Because we do know that when people go into a flare, almost universally, the first thing that they notice is they're much more tired. So that's the sign that tells them something's going on. And so it might be inflammation, or maybe it may be that you're trying to do too much. You're really trying to pack too many activities into one day and you're not giving yourself enough of a break. Or Eileen, you described the situation perfectly of a parent of a young child where you're not able to take a break sometimes. And so, you know, is it the way in which your lifestyle is structured right now and the demands that you have to keep up with? Or is there something else going on? Is there some anxiety, particularly in this time of COVID when everybody's feeling much more anxious? But anxiety is exhausting. Utterly exhausting. So could there be anxiety? Could there be depression? Could there be emotions that are contributing to this? Once we better understand what the contributors may be, then we know what the right solutions may be to help you feel a lot better.
That's very encouraging to hear that is being looked at. And each time we have one of these conversations, I'm so encouraged by the research that is going on in not just for the physical aspect, but for more of the emotional side, like mood, and for things like fatigue and how that impacts the patient's lives, because it's so important. So That is very, very encouraging.
Wait, Sandra, I'll say it again because I think it's so important. Fatigue is the poster child for why patients have to be involved with the research, with the drug development, with policy making, because it was patients who kept saying consistently to physicians and to others, it's the fatigue, it's the fatigue. It took decades, I think, for people to really begin to listen. But if patients hadn't been speaking up, we wouldn't be having this conversation. That I'm sure of.
That's a really great point to make, and that's why being your own advocate, as well as being involved with patient advocacy and having that involvement in these studies, you're right. It is extremely, extremely valuable. Chris, I wanted to talk. You had made a comment. We were talking about when being in the workplace. You wished that there was some way that you could have a cot and lie down and take a nap. And I think sometimes we don't allow ourselves those rest breaks. Can you talk a little bit about the importance of encouraging the balance between activity and rest breaks?
Yeah, it's nice to get the rest in there when I can, right? And yeah, it definitely needs a balance. I find starting exercise, it can be such a demotivator if I'm fatigued. It's really hard to get moving and start exercising. But the thing is, exercise always makes me feel better, never fail. Like it picks up my energy, even if that energy doesn't last that long. It's still a boost for a while. So they've been pretty accommodating at work as well for that. Like I try and take walk breaks. So I have a stand-up desk that I can move up and down. So I can stand, I can sit, and really alternate between different postures and different energy levels. So I think that helps a lot.
Shannon, you had mentioned that as well, of being able to recognize when it's time to just simply lie down. How do you fit that into your life?
Well, it doesn't give me a lot of choice. I'm forced to sometimes, and I think when I lie down, I'm going to go to sleep. And I end up not sleeping, but finding that just the laying down and the resting gives me enough to finish my day. I mean, it might be at 6 o'clock at night. It might be at 6:30. It'll be for half an hour, but at least it'll get me through 11 o'clock to go to bed and not, interrupt my sleep pattern if I do fall asleep. But you just kind of and it's a challenge to mentally allow yourself to do that and just go and listen to yourself and do what your body's telling you. That, I think, is one of the, like Eileen said, the guilt-inducing aspects of it.
So
I like to have a quick lie down too when I have a chance at home, and it's not sleep. It's like a 10 or 15 minute. For me, it's the ankylosing spondylitis is arthritis mostly focused in the back. So if I'm lying flat on my back on a hard surface, just for 10 minutes, it's a relief, right? To give your body a chance to recharge.
For sure. Let's move on to talking about, I think we've recognized that fatigue definitely can be a part of our experience as living with arthritis. And let's move on to some of the ways, the real life tips and tricks and hacks that we use. So I'd love to hear from the panel. What are some of the things that help you manage and live with your fatigue?
Hi. I have to be extremely precise and balance my energy, I find, just because I'm not looking after just myself, but I'm also looking after my 7-year-old son. So it's just, I have for the month my planner out, and I have to plan, okay, this day I can put in 2 activities. This day I'm going to take a rest. This day I'll put in 2 activities. So it's just kind of listening to my body, finding my limitations, and then also making sure I really stay on top of my exercise routine. As Chris said, sometimes there's days where I might miss a couple days of exercise and I'm just like, oh, I'm so fatigued. I feel so horrible. I know that I can get in that gym and it's going to make me feel so much better. And I also want to touch base on the not overdoing naps when I do take a rest in the day, which is usually around 3 p.m. for me, is like my cutoff point where I need to have a rest, but only making sure I do it for about 20 minutes to 40 minutes and nothing over 2 hours, because that's when the grogginess really sets in.
Yeah, that's a really good point. I think a lot of the notes that have come in, and I'll add myself to the list as well, that we're talking about exercise being a good way to address and manage fatigue. And initially, there might be, well, when I'm tired, how is that going to help? Dr. Bartlett, I know you have some experience in the background of the benefits of that for those with arthritis.
Well, my husband is an exercise physiologist, so we always talk a lot about exercise in this household. Both of us like to say that exercise is important for everybody, but exercise is absolutely essential if you have arthritis. It's not a luxury you can afford to not indulge in, because it improves your health, it strengthens your body, it improves your mind, and it reduces inflammation. So it's the trifecta of really what you need. We've done some studies looking at different forms of exercise, and I've been particularly impressed with yoga. I have to say, we did the largest randomized controlled trial that's been done yet in people with arthritis in yoga. And we put people on a simple 8-week program. Twice a week they came to the hospital and they had supervised exercise, and they did it once a week at home for just 8 weeks. And these were people who were completely sedentary. At the end of 8 weeks, we saw 20% improvements across the board in their physical health. They had much less difficulty with all aspects of the things they were doing at work, at home, social activities. They had 20% improvements in pain. They had more energy, more pep. They slept better. Their mood improved. And even 9 months later, those improvements were still evident. So I really like yoga because I think it gives you both the physical benefits, but it's also great for the mind too. But we've also done some work, for instance, with strength training more recently. And we found with 12 weeks of strength training, and this was in people who weren't exercising as well. This group was limited to people with rheumatoid arthritis, but 12 weeks certainly increased their muscle mass. And with that came improvements in fatigue, improvements in pain. They could walk better. They had a better sense of overall well-being, and reported their quality of life had improved significantly as well. So I think that people with arthritis need to keep moving. They need to be active and involved in life. They need to find something that's safe and effective and fun to do. And I encourage all the people that I work with to try a whole lot of things. Find what works for you. But if you haven't tried yoga, give that a shot too. I know I'm speaking with the West Coast. You're far ahead of us.
I'm just wondering where swimming came into that pool exercise, because that seems to be one that alleviates some of the fear of joint pain and possible, onset of a flare for a lot of people.
You're absolutely right, Shannon. I haven't done studies with swimming, primarily because the centers in which I have worked for the last 20 years or so, which have been in Baltimore, Philadelphia, and Montreal, we have a lot of women who are involved in our programs, and those women typically are cautious about getting into a pool. What it does to their hair. There are a surprising number of people who aren't comfortable in the water as well. So I haven't done those studies, but I certainly know the literature that talks about the importance and the value of swimming. So if you love to swim and you love to get in the water, more power to you. Especially, there are warm water pools with shallow, easier entrances that are made specifically for people with arthritis. In the United States, the Arthritis Foundation keeps track of where these pools are located. We're not doing the same thing yet in Canada, but often YMCAs and other community centers will have an arthritis-friendly pool.
I can speak to the yoga and the weight training as being hugely beneficial to myself, but I did go through a period of time in my early 20s when I had significant flare-ups in my wrists. So I would just say that yoga is accessible to everybody, but you have to learn your adaptations so that you can take weight and strain off of those areas, and don't let it scare you away if a part of your body is unable to do something at a certain time. There's always an adaptation and something else that you can be doing so that you can keep moving in that way. And I would also say, along with exercise, one thing that I was I definitely was not drinking enough water for a significant portion of my life. And just in the last year, I've made it a real goal. And I hardly ever experience fatigue. And I know that might have something to do with medication. My alert, like I'm just so much more alert when I wake up in the morning and I force myself to drink a big glass of water instead of going straight to the coffee pot.
Thank you for bringing that up, Samantha. It's really important. In our study that we did with yoga, the graduate student who was involved with me was so enthusiastic and so pleased with the results that she saw that she actually developed a certification program for yoga teachers to teach them about the needs of people with arthritis and how to modify all of the poses. And that's a really, really important point. So for anybody who wants to start yoga but hasn't done it before, you do need to find a yoga instructor who has advanced training and who can work with you to modify all of the poses. But another thing that I really like about it is that yoga teaches you to listen to your body. And it tells you that you're not going to feel the same every day, and that's okay, and you do what's right for you today. And I think that's such an important message.
I'm excited. I want to check out a local yoga instructor, and I haven't done that for many, many years, but you've inspired me to want to give that a try. I thought I'd just quickly check in across the panel. We've been talking about fatigue today and how that impacts those of us that are living with arthritis. It can be a big, heavy topic. It can be a constant, but we're talking also about solutions and ways to manage it. I'd like to ask the panel, what would you tell someone who was recently diagnosed and has come across this conversation, and what would you like them to know about fatigue and how you navigate through that?
I would tell them first things first, see an occupational therapist. They can really help you with tips and techniques on how to understand fatigue, as well as how to adapt your life to your specific needs.
And I think that the fatigue changes. So whatever you may be experiencing if you're newly diagnosed, you're also going to be starting drug therapy perhaps. So that to be aware that some of those drugs and sometimes small increment changes in those drugs, like I found with methotrexate, like a 0.5 milligram change in my dose would change my level of fatigue. So it's not as daunting as it feels, as much as it really feels like it impedes your life at the beginning. It may, but it will get better.
I would say don't lose hope and keep your motivation up as much as you can to get yourself moving as much as possible, because it's going to pay you back with dividends, even though it's hard to get started. And also one more comment with the medication too. I in my experience, I found getting off the medication was very fatiguing. When I was on higher doses of prednisone and I had to wean off the prednisone, it was very difficult. So it's kind of something that demotivates me trying to get off medications if possible, right? Because it's hard as well.
Nikki, you had mentioned making sleep a priority.
Yes. There would be times that if I don't get enough sleep, I notice the next day I'm even more fatigued. It's just not just tiredness. I feel like that's the case with everybody. But yeah, for someone who's new to fatigue, I would definitely say for them to prioritize sleep. So if you have an event or something to go to, make sure you plan things well in advance so you can get your sleep pattern in. Also, just really listening to your body. Your body, the energy just tells you, like, hey, today I'm just not feeling well. Just take it easy. Don't go to that dinner with your friends. Plan for next week.
I mimic everything that everyone said. Is such helpful advice and stuff that I think we all wish we had heard when we first were diagnosed. And just 2 things that I would follow up with are, don't forget to advocate for yourself. If fatigue is what is your primary symptom or what you find to be the most debilitating, don't hide that from your healthcare team. They're there to help you overcome your arthritis, and that fatigue is in that. And 2 is to leave no stone unturned. Don't just get used to it and think that this is the way my life is going to be from here on out. you will always wonder, could I have done more, if you don't try those things like exercising or hydrating or meditating or fueling yourself with the appropriate foods to be able to get through the day.
Such good tips. Does anyone have anything else they would like to add?
I have one more thought, and that comes from working with rheumatologists for a long, long time. And one of the things that I've learned from both patients and from rheumatologists is this is a difficult conversation for them, because physicians often feel like there's not much they can do about fatigue. So for many, they actually avoid the situation and they just don't bring it up. Others have actually even said to me, I don't ask patients about their fatigue because I don't want to cause any fatigue in them, as if asking the question would cause it. On the other hand, a whole lot have also said, I don't know what to say. And many patients have indicated that when they tell their physician that they're feeling a lot of fatigue, they get no answer. Don't stop there. Keep the conversation going. Work together to figure out what's going on. Shannon said so beautifully, sometimes it's a small tweak in the medication that can make a difference. Sometimes it's just moving to another same class, different drug can have a whole different effect. Sometimes it means that you've got to hold yourself a bit more accountable and push yourself, as Samantha has said, or Nikki, to make sure that you exercise. I like to say that the folks that I work with, the day that you least feel like exercising might be the day it's most important to do something.
Absolutely. Well, thank you to everyone who took part in today's conversation. I think it was really valuable, and I hope that people that are watching and listening to this will recognize that they are hearing from people that are just like them living with arthritis. This has been Arthritis Wellness Conversations. I'm Sandra Sova, and we will see you next time.